Getting a clearer picture of when the need for hospital beds will peak here in Tennessee and how many we'll need. For the first time, we're seeing modeling done specifically for Nashville and the state of Tennessee, and it shows promising numbers if we continue social distancing. News 4's Nancy Amons has the story.
Tennessee is fighting an invisible virus, and to knock it out, health officials know what works: social distancing. Here's Dr. John Graves of Vanderbilt University.
This line is tracing out a trajectory over time for South Korea.
South Korea implemented social distancing and it worked. And his numbers show that Nashvillians staying home, well, that's working so far here.
Tennessee, at the statewide level, starting to remove itself from that initial exponential trajectory.
What happens next? He says if we continue social distancing through May, the first wave of the epidemic peaks in mid-May. We would need between 2,000 and 3,000 hospital beds statewide, and we have about 7,800. If we maintain the status quo, the epidemic peaks in June, and our hospital system is stressed to capacity. So what exactly is the status quo? He says every person infects 1.4 other people. If that happens, we need a lot more beds, maybe 5,000. And his research concludes that lifting the social distancing scenario overwhelms hospital capacity in mid-May if it's done prematurely and without widespread testing and contact tracing in place. Are we testing enough now?
We're definitely not at the place right now where we have that widespread testing that would be a necessary condition to start to relax social distancing.
I asked if the state is still expecting to use 1,600 beds that were going to be set up inside the Music City Center. They haven't answered that question. They say the full report will be released tomorrow. Nancy Amons, News 4.